Today we are looking at the color coding, and this is of the IV cannulae. So to start off with few questions, what is the size of the color coding gray? What is the size? Next question is 103 ml per minute flow rate is achieved by which color code? Third one is, in case of the pediatric usage, it's a favorite question, in case of the pediatric usage, which size is used? So we'll find out the answers to all these questions and we'll learn a lot more. So firstly, going on with the first is not 16, it is 14G. So firstly we have 14G, it stands for the color code orange. And what is the flow rate? The flow rate for this orange is nothing but it is 270. 270 what? 270 ml per minute. So where is this 14G used? The uses include, there is in case of trauma. So in case of the trauma patients, next in case of rapid transfusion, and in case of the large volume replacement. Next we move on to something known as the 16G, and 16G is for gray, and the flow rate is less, so it's 236 ml per minute. So there are only two which are above 200, that is 236 and 270, that is gray and orange respectively. So in case of the gray, 236 ml per minute, and where it is used, similar, that is in case of the trauma patients. It is used in case of the major surgeries. And next it is used in the intrapartum IP as well as the postpartum PP and the GI bleeds. And next, where and all it is used? It is also used in case of the in case of multiple blood transfers, and in case of the high volume of the fluids. Next we move on to the 17G. So the 17G, the color is white and the flow rate is almost half, it is 125 ml per minute. And what is the use? It is actually recently done, that is, it is very new, and it has similar, such as it can be used in case of the blood products delivery. Next we move on to 18G, and 18G, what is done is it is used for the blood products and also the delivery of medications. Next, it can also be used in case of the major surgeries. Also in contrast study. Next what we look at is the 20G. So 20G is it is pink in color and the flow rate is 67 ml per minute. The next question being, what is the use? So it can be used in case of the general use, that is IV. It can be used for the maintenance, that is also the IV antibiotics, as well as the IV analgesics. Next we look at the 22G. So 22G is nothing but it is blue in color and the flow rate is 42 ml per minute. So what is the use? As the size is smaller, so here as the size increases, the diameter it decreases, it is inversely related. So in case of blue, that is 22G, the size is small, so it is used in case of the small and the fragile veins. Also, it is used in case of the cytotoxic therapy. Then what we have is the 24G. So 24G is yellow in color, and the flow rate is about 20 ml per minute. And where it is used in case of the pediatric usage. Next, we move on to the higher number, that is 26G, and it is nothing but the smallest diameter. That is in case of violet. This is violet. It is about 13 ml per minute. And other thing to note is that it is newly added. It is newly added. So there are two newly added ones, that is white and violet. So white is nothing but it is 17G. Violet is 26G. The flow rate, white is 125 and violet it is 13. Okay. To answer the questions we asked, the first one being what about gray? So gray, the size is 16G, and we discussed it has a flow rate of 236 ml per minute. It can be used in case of trauma, major surgery, in case of intrapartum, postpartum, GI bleeds, as well as in case of multiple blood transfers, and it is for the high volume of fluids. So that is about gray. And next question was in case of 103 ml per minute, what is the color code? So this color, it is commonly used, it is 18G, and it is green. So green 18G is present, and where it is used in case of the blood products. So it is used in case of blood products as well as the delivery of the irritant medication. And also in case of major surgeries it is used and has a contrast study. Next we move on to the third question. So third question is in case of the pediatric age group. So the pediatric age group, what is the color code? So pediatric age group, it is nothing but for 24G, and it is yellow, and the flow rate, if you see, it is 20 ml per minute. So it has a least flow rate. It's easier to remember. In small kids, it's 20 ml per minute, and it is for 24G, and it is yellow in color. Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.